Welcome back to Living 808. People suffering from debilitating back pain sometimes avoid seeking treatment because they are more afraid of spine surgery and its possible side effects. But cutting-edge technology is changing all of that, and here to tell us about it is Dr. William Beringer from Adventist Health Capital. So thank you so much for being here. I appreciate it. Yeah. All right, we are talking about the spine, so let's just get an overview of the spine. It's a big deal.
Well, I mean, there's at least three basic areas of the spine. There's the cervical spine in your neck, the thoracic spine from here to here, and then we're basically where your ribs come off of, and then your lumbar spine that goes all the way down to your sacrum. In America, we tend to have more cervical problems and lumbar problems. Those are more mobile segments in your spine. And in between each vertebra, all the way down, starting from the base of your skull down to your sacrum, you have a vertebra and a vertebra, and in between those two vertebrae is a disc. Frequently, the discs wear out as you get older, or they can herniate from various activities, trauma, wear and tear, chronic wear and tear even. And they can push up against a nerve, or they can push up against the spinal cord. So if my body was the spinal cord and my arms are the nerves coming off of the spinal cord, there's the different locations where you can get a pinch. It would be against the spinal cord, which would be pretty serious, or you can get it up against the nerve on the side. And then, you know, depending on what the pathology looks like and what your joints in the back of your neck look like, you might be a candidate for an artificial disc like a Mobi-C, or you might be, you know, somebody who needs to have a fusion.
The Mobi-C, however, sounds like a pretty good option. Can you tell me a little bit more about that?
Well, what's nice about Mobi-C, you know, artificial discs have been out for at least 15 years. It's not experimental at all, and it's a more evolved, kind of like a third-generation artificial cervical disc made by a company. And they've got great research on, you know, the reduction in adjacent segment disease. So, you know, a lot of times when you fuse somebody's neck, the level above or below gets more wear and tear, and then those break down, and then you got to get another fusion. So for Mobi-C, what's nice about it, among the other things, is that it maintains the range of motion. And so they can keep moving. The patients after the surgery, they don't hurt as much because they can find that position of comfort, and I don't have to keep giving them pain medicine because their neck isn't locked into a given position when they're not fused. So they have that motion. So in the middle of the night when their neck's bothering them, they're not stuck. They can adjust, and then they're back into the game and they're feeling better.
You guys are one of the only ones that do it on the windward side at Adventist Health Castle. What are some of the other benefits of the Mobi-C as opposed to doing some of the other
Well,
surgeries?
Structurally, Mobi-C, you know, it's a polyurethane insert basically with two metal plates that engage with your end plates of your vertebral bodies. It's very slim. It doesn't require a whole lot of dissection. You have to be careful on your placement. And so not a lot of neurosurgeons or spine surgeons do it yet, but the amount of dissection you have to do is actually less than a conventional artificial disc or a conventional fusion, if you have to have a fusion in your neck. The amount of trauma and the recovery period is a lot quicker. But again, coming back to the fact that these people can still maintain the range of motion and find that position of comfort, they get better faster, they go back to work.
Okay, and if you're having an issue with your back or spine or your neck or some part of your spine, the best place to get some information is AdventistHealthCastle.org, or you can call the Castle Joint and Spine Center at 263-5220. Doc, thank you so much for being here. I know it's a big problem that affects probably, what, 2-3 people out of 5?
It's 2 out of 5 at least,
Thank you for the information.
Appreciate it.
All right, take care. All right, we'll have much more when Living 808 returns.